Well, feeling fresh and fabulous isn't just for women. In fact, more and more men are finding their way to the fountain of youth.
I like to feel fresh sometimes. Houston Life contributor Michael Pierce did the dirty work for us, and he's giving us a glimpse into the world of man maintenance. Watch this.
Ladies, are you finding it harder and harder to get appointments at your favorite med spa? Today, we're going to find out who's taking those appointments, and the answer may surprise you. I'm here with my friend Melanie Fry, nurse practitioner at Utopia Med Spa. So Melanie, tell me, a lot of my friends are telling me that their husbands are actually going with them to the med spa. Are you seeing that here too?
We're seeing a lot of it actually. We actually consider men one of our fastest growing client base, so it's pretty exciting.
What sort of things are guys coming in and getting done with you?
We're seeing a big trend toward guys coming in to treat their double chin.
Oh, that is a serious problem. Ladies think they're the only ones, but it is a struggle, and it is real for us guys.
That's what we look at, and that's what guys are looking at, especially men. We want to have a more masculine jawline, and if you have a little excess fat under the chin, it kind of interferes with that look, that profile image.
What sort of things do you think I could benefit from today that we should probably work on?
Well, from our initial assessment and examination, I did notice that you have a little bit of volume loss in your mid-face, and that's very common for male patients. In fact, we see a lot of guys that come in that, they work out and they keep their body looking good, and then their face starts to notice these, hollowed out spots, and they lose their buccal fat. So what we'll do is take a product, and the product I'd like to use today would be Voluma. It's a larger molecular weight product, so it gives a little bit more lift and volume. We use that in the mid-face, just very subtly. We're only going to use one syringe just to kind of give you a little bit of lift.
All right. Well, you think we can do that now today?
Yeah, we sure can.
Go back and try. Let's go in and give it a try and see. I'm all eager to see what we can fix it up.
Sounds good. Let's do it. This is a topical numbing, and we use this just to try to reduce the pain with the actual injection, but it doesn't take away all the pain, unfortunately. You'll have a little bit of bruising, a little bit of swelling after the procedure, and that usually takes 3 to 5 days to go down at the most. All right, you ready?
No, but yes.
Okay, so you're going to feel just a little tiny poke. Great. There you go.
All right. So
right?
I'm good. I'm good. It wasn't as bad as I thought. So how do I look? I look pretty? Well, I know not Jennifer or Derek pretty, but pretty for me. For a couple $100 in a matter of moments, you get instant results. You can see why Houstonians are flocking to the med spa. So if you notice your friends or their husbands are looking a little bit more refreshed, you know why.
Oh, jeez. I need a minute to recover from this. Are we allowed to show that on television? Well, listen, you saw them just now in the piece. Here to tell us a bit more about the man maintenance experience is Houston Life contributor Michael Pierce and the woman who stabbed him with that needle, Melanie Fry, nurse practitioner. Thank you both for joining us.
Thank you. You could have warned me that you're going to be that close up at the camera. My gosh, I know it's a Halloween show, but I'm going to pass out here.
Okay, but I have to ask you, did it hurt?
Okay, I will be honest. I'm a big freak phobic of needles, so that's why you saw me twitching. It didn't hurt. I didn't bruise at all. I may have been psychologically scarred, Melanie, but it did not hurt.
But Melanie, you do this every day, right? And it seems, we just saw this in the piece, but more and more men are maybe choosing to do these types of procedures, yeah?
Right. It's growing in popularity amongst all ages of men, too. So it's been very interesting to see.
Now, we want to talk about 3 of some of the most popular procedures that men are doing. I'm assuming that injection we just saw is one of them?
It is one. I will say, when I walked in, she thought, oh my God, this is great. My kids are going to go to college, go to Harvard. I can retire off of this guy. But I went to her because she knows how to treat men. And actually, she treats predominantly a lot of men. And there are 3 different ones. One was the Voluma filler that you did on me. The other one was Kybella. And then the needling that I can't dare talk about.
So let's talk about the difference. Let's start with, first of all, the procedure that Michael had done.
Right.
The Voluma. So that just like fills in?
Yeah, it's a larger molecular weight filler, and it's designed for the mid-face. So the cheek area is kind of where we went with Michael. And believe it or not, he really didn't need a lot. We like to keep a very natural look.
I'm paying her extra to say that. You heard it on camera.
Especially for men, you want to maintain a little bit of ruggedness. You don't want to chase every wrinkle. So we just added a small amount of volumization just to kind of keep them lifted in here.
And then how fast do you see results?
That's what I love about it. You can do this on your lunch break. You immediately get results. So it was fast, quick, and inexpensive. expensive. I had a face-up the year before, like, love
On
it.
your lunch
I'm just
break?
thinking, you go
On
in,
your
you're all
lunch break.
saggy in the morning to work,
walk out,
go to
"Look at them,
lunch, and you're like,
gorgeous."
woohoo, look
They
at
do.
me.
Well, okay, but I also have to ask, before we move to the next procedure, I have seen some bad injectables,
Yeah,
and I've often heard, I haven't tried them myself, but I've often heard that the person who does the injections, where you go, is critical. Because, you know, oftentimes, even here in Houston, I see men out and about who have clearly had some sort of something to the face, and I'm like, they look like they're 30, but how old are they? Are they, you know, three
Right.
times that age? So talk to us a little bit about the importance of how the procedure is done.
Well, it's very important to choose the right person who's going to be conservative, and they're also going to maintain a normal, you know, anatomical border on that person. For instance, males, you know, they don't have as much of an anterior projection on the cheek. Females, we have a little bit more of a rounded out cheek in that area. So you wouldn't want to, for instance, give a guy female cheeks, you know. So it's very important artistically, you know, to choose the right person.
So don't get a Groupon
Don't get a
for these injectables.
You don't want to go to that Botox
So
party at
let's
Home
take it
Depot.
from the cheeks then down to, say, the chin, because that's what
Right.
Kybella, it kind of gets into that area, correct?
Exactly. Kybella is a new, exciting new product that actually dissolves fat. So, you know, if you have a little extra genetically, predisposed fat in that
We're
area,
all now going like,
yeah, you
do
can feel
I have
it.
that? Do I need to do it?
It will dissolve that fat. You know, the downside is that you have to be careful to make sure that you're the right candidate. For instance, if you have a lot of loose skin in that area, you wouldn't want to have Kybella done. So, you know, there's a clear patient that's the right fit for that.
Now, there's another procedure called microneedling. Michael just mentioned he would not do this procedure.
Getting hot right now talking about it.
But
I know it
Melanie-
takes a lot to look like this, but no.
Microneedling is something I just heard of a few months ago, and
Yeah.
this is something that includes sticking a bunch of needles?
Right. It's
in
a
your face?
pen-like device that's sterile, so we only use a cartridge for one person. That's very safe. And it actually pokes small little tiny holes in the skin in order to stimulate skin cell turnover. So it's great because it creates a little injury and forces your skin to repair itself from the inside out, correcting fine lines, texture, pore size, you know. So
Okay, that's not one you can do on your
A
lunch
lunch-
hour then,
exactly.
right?
no, that's not a lunch hour,
Are
but
amazing. Like, it's
Right.
amazing. You look, you have a rough spot to heal, but the after is phenomenal. Like,
How long does that take to heal?
it's about 3 days of not looking so great, although you can use makeup the next day. So for a woman, you know, we can sort of hide it. For men, it's a little harder because, you know, they don't typically put on a bunch of makeup.
So
the
schedule
next
it
day.
on a Friday.
On a Friday.
Words
and-
of wisdom from the pros. Melanie Fry, thank you so much. Michael Pierce, you're
You are a
always
brave
hilarious.
one.
I am brave. I do things for anything for you guys.
It was great.
All right, and coming up next, we are shaking up some fall flavors with autumn-inspired cocktails. Stay tuned.